look at suicide in cancer, surprisingly, the highest suicide rate is immediately after the diagnosis. This is not the time necessarily of greatest physical suffering, but is the time of greatest fear. People fear death, people fear dying, vulnerability, pain, suffering. And people feel dependency, the fear of depending on other people, which in a culture which values self-sufficiency and competence can be very threatening. I mean, some people live with the fear of cancer even before diagnosis. People that have genetic risk in their families, people that have other risk factors. So sometimes there's a lot of fear and worry even before the diagnosis.
It's the socially inherited discomfort we have. You know, our grandparents, it was the C word. They didn't talk about it. Our parents started talking about it, and now all we do is talk about it, but we actually talk around it. And there's this social censorship and it's this, you know, prescribed way of what we want to hear and say and think and do about cancer.
When I first started in oncology in the late 70s, it was almost talked about under the covers. Patients didn't necessarily get told they had cancer or maybe didn't even want to know. And survival rates for some of the cancers were really awful.
There are other common diseases which are also fatal, which have not had that same stigma. There has been speculation about why. Some of it is about the physical manifestations, that certain of the treatments like chemotherapy cause hair loss. The disease can cause physical wasting, where people can become gaunt and malnourished. And there's pain and suffering. And it sometimes affects young people. And I think all of those things are factors that contribute to the stigma.
I can remember the first medical oncologist who came to our hospital in New Zealand was treated like a witch doctor. He used to walk down the corridors and people would talk about him as he went down because he was that guy who came and poisoned people. Radiotherapy was talked about as all about burning and really quite awful analogies that people were using. And so the treatments were as frightening as the disease.
My biggest challenge was the stigma and the taboo. And then the cancer center that we were building there, the name of it was the Hope Center. Notice the omission of the word cancer. So that's the atmosphere that we were in. Culturally, people thought that it's contagious. They had so many myths about the disease that perhaps it would ruin chances of their daughters marrying into another family, husbands divorcing their wives, you know, all these things that, by the way, 50 years ago in the developed world, that was the same thing.
Well, 50 years ago, cancer was a death sentence, and most patients with cancer died. Cures were very infrequent.
It's easier to talk about breast cancer than to talk about cervical cancer. It's not easy to say that you've been treated and you have a bag on your tummy, or that you can't talk any longer, you have to push a button here to talk, and you don't really talk about the lives of people when they survived, like cancer and sex. If your body has changed in the inside and outside, how would a new partner look at you?